Dear colleagues, I demonstrated you the new Weberneedle multi-channel laser device already with acupuncture treatment and with the big body shower. Another accessory for this therapy is a small shower. The body shower has in total 16 holes for application of maximum of 16 laser needles. The small shower has in total 5 holes for treatment with 5 laser needles. So, for example, I can put a red, an infrared, a green and blue laser at the same time in this small shower. And the big advantage is of the small shower that I can treat difficult areas, maybe on finger joints or maybe in the mouth or other places where I cannot use the big shower head. Also, this shower consists of 2 parts, an upper part and a down part. You see, I put the fibers inside, and with the upper part now the small shower is closed. And the big advantage again is that I can treat with the different lasers at the same time to achieve different biological effects and also different penetration depths. Here you see the mixture of the blue, the green, the red and the infrared light, which can be applied all together at the same time. So, for example, you see here that I can perfectly treat the small finger joints or even between the fingers for rheumatism, for example, or polyosteoarthritis, of finger joints, of wrist joints, or other joint areas on the body. And also I can use it from a more distant to treat problems in dermatology like chronic wounds, like psoriasis, or maybe rosacea, or acne, or other dermatological diseases. So another option is to use this small shower within the mouth. For this we have to protect, of course, the shower head with a sterile plastic transparent wrapper. So you see, we put the shower head in this transparent wrapper, and now it's sterile at the end. And now we can use it for treatment in the mouth of teeth, of gingiva problems, of chronic tonsillitis, herpes, ulcera, and a lot of different pathologies. Again, you see the mixture, and now I apply the laser beam within the mouth for treatment of all these different pathologies. Especially chronic tonsillitis in children who have very, very often infection, this is quite effective. Or in caries or all these gingiva problems on the teeth. One of the biggest advantages of the intraoral treatment is the so-called sublingual systemic application of laser light. Everybody knows that we can use a lot of drugs sublingually, and the drugs go immediately in the blood circulation and have not to go through the stomach and the liver. And so we can achieve the same effect with the laser. The different laser beams are now going in the big veins of the ground of the tongue, and the applied energy is going directly in the circulation and delivers a lot of energy to the patient immediately. So we can use this sublingual treatment for any treatment of systemic diseases like chronic fatigue syndrome, like diabetes for improving metabolism. We can use it for multiple sclerosis and microcirculation disease, for example, in cardiovascular diseases. So all systemic problems with mostly lack of energy can be treated highly successful with this intraoral treatment.